Hello everyone, and for those of you who haven't been here yet, I'm Linda-Gail Bekker from the International AIDS Society. I'm the current president. I also live in Cape Town in South Africa. This briefing, just to remind everyone, is being live streamed on the International AIDS Society IS 2017 virtual conference page, and we can make a recording available to you afterwards. I'd like to extend a warm welcome to those of you who are joining us from afar. The theme of this morning's press conference is impacts of investing in HIV. And I'd like to start by just sort of putting a preamble around scene setting. Clearly, this is an absolutely, cornerstone of our response and really runs through the fabric of our conferences, because without resources, we will not be able to do what needs to be done. And the sad truth is that global HIV funding has been declining in recent years. The group that reports on this often, the Kaiser Family Foundation, recently released a report from UNAIDS, a report as well as one from UNAIDS that found that government funding for HIV fell for the second year in a row in 2016, declining 7% over the previous year. In current US dollars, this brings disbursements to their lowest level since 2010. Additionally, a new AVAC report found that funding for HIV prevention R&D, the heartbeat of this conference, in 2016 decreased by 3% from the previous year, the lowest annual investment in more than a decade. And today, as I mentioned last night, major government donors, including reports we've heard from the White House, are either calling for or considering further cuts to scientific research funding. Current attacks on HIV research funding threaten to stall or undo recent progress. Even more importantly, perhaps, funding for programmatic, everyday life-saving therapy is also very much at risk. Through investments like PEPFAR, we've seen what can be achieved when nations and donors come together. And I think the story you heard about Swaziland really, we hope, will be the kind of narrative that really brings home what can be achieved when we all draw together and use the resources at our disposal. We'll hear from a range of experts today, really representing a range of experiences who all know firsthand the importance of investing in HIV research and programs. Our experts will speak to the return on investment in HIV funding. So again, something I was taught a long time ago, don't ask without offering. So our offerings are that we are making remarkable progress. Things are really beginning to happen, but we need the funding to be able to finish the story. I'd like to draw your attention to a few relevant studies. In the Care for Kids session, researchers will share results from randomized controlled trial in South Africa, assessing costs and benefits of integrating HIV in maternal child health care. This study looked at the potential for perinatal home visits to influence better health outcomes for moms and babies. Another study, when donors leave, another session when donors leave, will feature an analysis of the direct costs and savings of differentiated care models in 38 sub-Saharan African countries. That session will also include a case study of the immediate and direct impact of the phasing out of USAID funding for HIV services and health facility staffing. So these and other studies presented this week contribute to the growing body of evidence around both the impact, the positive impact of investments in HIV, and also the devastation when those investments aren't there. So for today's speakers, we are going to hear about the human toll of proposed cuts to the US global AIDS budget, the need to fund and strengthen community support for implementing HIV programs on the ground, the importance of global HIV funding for populations living with or at greatest risk of HIV, and how they would be affected by funding cuts, and the need, importantly, the need for continued investments in research to better understand the response to the epidemic. So, beginning with the numbers, I'm going to call on Greg Millett, who is the Vice President and Director of Public Policy at amfAR, the American Foundation for AIDS Research. He will highlight the main findings of a recent amfAR and AVAC analysis on the U.S. administration's proposed cuts to PEPFAR and what those cuts are going to mean to people on the ground. Greg.
Thank you, and good morning, good afternoon. We'll gather at this year's International AIDS Conference at a time of unprecedented achievements in addressing HIV globally. UNAIDS released a report last week highlighting major progress, that new infections declined globally by 16% and AIDS deaths plummeted by 32% between 2010 and 2016. And more than half of the 37 million people living with HIV globally are accessing antiretroviral therapy, which are medications that dramatically prolong life and prevent HIV transmission to others. Much of these achievements are due to PEPFAR and the Global Fund. PEPFAR supports nearly 11.5 million people, including 1.1 million children. And last year alone, PEPFAR directly supported HIV testing and counseling for more than 74 million people in care and support services for 6.2 million orphans and vulnerable children. Global Fund investments have also produced remarkable results. As of mid-2016, Global Fund financed programs that have supported treatment for 10 million people living with HIV/AIDS. In addition, 3.8 million HIV-positive pregnant women have received care to prevent mother-to-child transmission. With sufficient resources, PEPFAR and Global Fund efforts can reduce new infections even further, and meeting the 90-90-90 targets can reduce the number of new infections globally can decrease the number of new infections globally to under 200,000 per year by 2030, compared with over 2 million per year in 2030 based on only maintaining current treatment and prevention coverage levels. But meeting these targets are at risk of being undermined. As Linda-Gail Bekker just mentioned, the Kaiser Family Foundation released a report last week which showed that donor government disbursements for HIV fell for the second straight year from $7.5 billion USD in 2015 to $7 billion USD in 2016. Shockingly, this 7% drop brings donor giving to fight global AIDS to levels that we have not seen since 2010. In fact, total giving decreased for 11 of 14 donor governments in 2016, and only increased or remained essentially flat for 3 donor governments. In 2016, the U.S. was the largest contributor among donor governments, providing $5 billion, followed by the UK, France, the Netherlands, and Germany. This decrease in funding for the second year in a row is concerning, because investments now through 2020 are crucial if we're going to end AIDS as a global health threat by 2030. The largest drops in funding between 2015 and 2016 were from other countries and not the United States. But because the United States by far provides the greatest share of funds to fight HIV globally, it bears looking at planned funding from the United States. The White House earlier this year recommended a $242 million cut in PEPFAR funding for the remainder of fiscal year 2017, which represented a 6% percentage budget cut for PEPFAR. This seemingly modest cut would have had devastating effects downstream, including 253,000 adults and 50,000 children experiencing HIV treatment interruptions, and resulting in as many as 40,000 deaths. These cuts did not come to pass this year, primarily due to bipartisan congressional intervention, but now the White House has proposed an even greater budget cut in 2018. These cuts, a cumulative $800 million in cuts from PEPFAR and USAID, would represent a 17% decrease in funding. Based on projections from amfAR and AVAC, this may result in 1 million HIV-positive adults and children experiencing HIV treatment interruptions, 145,000 total AIDS deaths, and 7,000 newborns born with HIV. Keep in mind that U.S. spending on global health accounts in total accounts for less than 0.25% of the U.S. federal budget. The progress that has been made for this investment is remarkable, and we cannot afford to watch it slip away. I began talking about the remarkable news announced by UNAIDS. Investment in global HIV has a measurable impact that saves both lives and money. More importantly, the impact is immediate, not a generation from now. And potential cuts will have corresponding effects now and not only generations from now.
Thank you so much, Greg. Sobering numbers. Our next speaker is Solange Baptiste, Executive Director of the International Treatment Preparedness Coalition. ITPC is a global movement of people living with HIV, treatment activists and their supporters dedicated to treatment access for all in need. Solange will share the community perspective on global financing for HIV. Thank you.
Thank you. Bonjour à tous. Thank you, Linda. I'm really going to be building on Greg's comments. Both Ambassador Birks of PEPFAR and the UNAIDS Director Michel Sidibe agree that there's a $7 billion gap for HIV funding annually. Now, if we assume that the funding trends are correct, global funding for HIV is going to decrease, and more countries will be expected to fund and sustain their HIV response without external aid. Now, we need to note that all of this is happening in the context of test and treat, where the WHO estimates that the number of persons who will need lifelong treatment will explode from 18 million to 30 million in 2020. That is in 3 years. So quite frankly, this makes us as communities quite worried, and I'll tell you why. First off, most governments don't actually know what their HIV response costs. Cost estimates are often based on assumptions of how things should be and not how things actually are, and they're usually based on citizens only. But as you can imagine, this is not the reality in any country. It is 2017. Tell me which country does not have migrants and cross-border populations. Any costing done without these communities is severely underestimated. The second problem is related to the simple fact that we know that there's just not going to be enough money. We need only to look at the 2001 Abuja Declaration, where we see that only 2 of the 55 countries in the African Union have attained the 15% commitment of their national budget for health. This means that we must now rely on governments with little to no health money to prioritize who gets care. The problem is that HIV is moralized, and therefore it is politicized. If we are honest, we know that governments will not prioritize those most affected by HIV, those who are often criminalized, those who are most vulnerable, and quite frankly, those that do not show up at all in our data. We cannot end AIDS like this. So the question then becomes, how do we deal with governments who are failing their communities? We have to apply pressure from civil society to insist on appropriate quality HIV prevention, care, and treatment for all people, and insist on safe, effective, and affordable treatment for all. 90-90-90 is a goal for all ages and all communities, not just some. What else can we do when governments are failing communities? Bypass them. Communities can and have been known to take care of their own. Everyone can remember back in the day when ART was distributed exclusively in a pharmacy. Today, under one of the most successful models for differentiated ART delivery, we gave it a fancy term, a lay person can go now and collect medicines on behalf of other people and then go and distribute it under a tree. What does this tell us? When you meaningfully invest in communities, you can do more and you can do better. Community investment is not a new idea. I didn't just come up with this. ITPC does not own this. And quite frankly, it's quite overused. But we need to be clear about what we mean, what we as communities mean by investment. It is not about spraying us with money. It is about actual, incremental, and sometimes, yes, painfully slow community systems building. We mean spending money. We mean spending time, spending resources to build leadership, to improve technical capacity in program planning and data management, strengthen organizational systems of finance, enhance M&E standards, and contribute to staff salaries. Somehow people just expect to not be paid, I don't know. Few donors get this. Many shy away from this type of investment because they have a crazy expectation to find ready-made, community-based organizations. But the reality is that technical and financial investment is still needed to support communities to have a meaningful and robust voice at the table. For instance, we cannot shift tasks, task shifting, to communities unless there are policy changes and we actually pay people a living wage, rather than asking them to volunteer. ITPC's Regional Community Treatment Observatory is an example of putting power back into the communities. Our community monitoring project in West Africa is funded by the Global Fund and supports people living with HIV and key population communities to use technology to capture data that is relevant to them, not just what everybody else wants you to capture, such as the quality of services and the frequency of stockouts for national and regional advocacy. We turn community data into action. At the end of the day, though, all of these investments are a waste if communities do not understand the basics of HIV. Just last month, I spoke with a leader of a PLHIV network in West Africa who has been positive for 17 years, but was not on treatment despite access. Why? He had absolutely no knowledge about the actual effectiveness of ARVs. It is 2017. How is this possible? To this day, ITPC still continues to work with people living with HIV to help them better understand the importance of treatment and how to advocate for it. It is with knowledge, not just pills, that people can take care of themselves and advocate for their right to health. Treatment education is and will always be the core of our work, as it remains the single best investment in communities. Thank you.
Thank you, Solange. Next up, moving to a population that we know is to a certain extent left behind. We'll hear from Charles Lyons, better known as Chip, President and CEO of the Elizabeth Glaser Paediatric AIDS Foundation. Chip is a long-time advocate who brings a passionate commitment to his work on behalf of children, HIV, and global health. And he will provide an important perspective of organizations that are implementing HIV programs on the ground. Chip.
You might need this.
Yeah, thank you. Linda-Gail, thank you. I'll be brief with just a couple of points. I think the previous speakers have set a context, have provided specific numbers and an important perspective from Solange, from the field, and from communities. The Elizabeth Glaser Paediatric AIDS Foundation has activities in 19 countries. We support 6,000 plus sites every day, every week, particularly with the purpose of ending AIDS in children. But you do that by supporting communities and families, of course. So there's a wider perspective as well. The notion of severe cuts that came out earlier in the year certainly concentrated, I think, everyone's minds. EGPAF, our organization, cannot speak for other organizations, and we do not do that. We speak for ourselves and for those that we serve. Material cuts on the front end will lead to material setbacks and impacts on the other end. So if EGPAF is faced with, and there were all sorts of scenarios, 10% cuts, 15, 20, 30% cuts, they will have a corresponding negative effect on the other side. There are going to be fewer people who are tested. There will be fewer people who are identified. There are fewer people who will be initiated and retained on treatment. In our areas of work, that means kids, that means moms, it means families. And so there we will stop the decline in new pediatric infections. And by the way, EGPAF is one organization. We're not going to end AIDS in children singularly because of the Elizabeth Glaser Paediatric AIDS Foundation. It takes everybody to accomplish that. But it's indicative, is my point. And so we will see fewer tests, we will see fewer kids on treatment at a time when we're already behind the 8 ball in terms of achieving the 2018 targets. A year ago in Durban, there was considerable enthusiasm about the political support at the high-level meeting last summer, specifically also for kids and 2018 targets. Well, a year later, I hope people are a little more sober about that, because we have not seen the kind of urgency that was called for last year. We have not seen the do business differently that was called for last year. And so there's going to be some, I think, some tap dancing about what needs to happen to get back on track for those kids. In that context, proposed serious cuts are deeply discouraging. One has to figure out what the different hypothetical scenarios might be. I think it's important not to overreact at the same time. This is the beginning of the story. It's not the end of the story in terms of budget, notwithstanding Greg's important points about trends. And so my last point, and by no means do I want to even remotely give the impression that everything will be okay, but it's important to recognize and see signals when they happen. Given the outsized leadership role and resources provided by the United States, let us all remember that it is Congress that sets funding levels in the United States. So there was a budget that was proposed several months ago. Congress has taken the first step in response to that. And that first step includes holding the funding level at 2017 levels, not using the numbers that Greg referred to of $800 million in cut. I emphasize that's an initial step. There's a long way to go, but when some of us in the past have talked about strong bipartisan support in the United States by the U.S. Congress as it relates to PEPFAR, including the Global Fund, we have seen this first step from this part of the Republican Congress maintaining funding levels at 2017. It's a big deal. It's a very big deal as a first step. I'm a little surprised it's not more widely known. I'm not talking about in Paris. People in Paris aren't walking around talking about the U.S. Budget cycle, but even beyond Paris. So we need to keep saying the things that Solange and Greg and Linda-Gail and others are saying, but let's also look for and encourage those signs that there is agreement we have to maintain funding levels. We will not end AIDS in children by 2020, which everybody has endorsed. And there are a number of other things that we won't be able to do, and we'll see setbacks if we don't have high levels of investment continue. Thank you.
Thank you very much indeed, Chip, and thank you. You know, I agree. I think it was looking for the reassurances as well to reinforce those make a lot of sense. Our next speaker is Christine Lubinski, Vice President for Global Health at the ID Society of America. Christine is a policy analyst focused on the role of U.S. leadership in the HIV response, and I think we'll add more comments to what I think Chip has just had to say.
Yes. Thank you very much. So just to explain that my perspective is really informed by the membership I represent, and that is 11,000 infectious disease scientists and clinicians, 90% of whom live in the United States. But a good many of whom have been leaders in the HIV response as both researchers and program implementers. So our members include Tony Fauci, Mike Cohen, the principal investigator of HPTN 052 that demonstrated that treatment is prevention, Dr. Wafa El-Sadr, who spoke this morning, Diane Havlier, the PI of the Amazing Search trial, just to name a few. So they are, as a group, and I who represent them, incredibly concerned and committed to see that research progress gets translated to the community and to the bedside. And I want to mention, because it hasn't been mentioned yet, that in addition to the draconian cuts proposed for HIV program responses through PEPFAR and the Global Fund, the budget also proposed a very deep cut in biomedical research. And as in global health, the U.S. leads the world in funding for biomedical research and for HIV research specifically. And I think we all know that notwithstanding the tremendous progress that is demonstrated by the results announced from Swaziland today, for instance, that we still have a significant research portfolio ahead of us. We need a cure. We need a vaccine. We need to continue to test these exciting new long-term injectables, which could make treatment so much easier for so many challenged health systems and challenged patients in the global south as well as elsewhere in the world. I was hoping to convey the good news that Chip stole from me, that in fact, the first movement of the US Congress has been not only to reject the proposed budget cuts in HIV program responses, but also to reject the cuts in biomedical research. And demonstrating, I think many of us who do this policy work, we're nothing short of euphoric to see the House of Representatives Funding Committee reject the Trump budget for research and global health, and global health writ large, I may add, not just for HIV responses. And it's given me a great deal of confidence because actually currently the House of Representatives, the more conservative body of the United States Congress, making at least me feel as a policy advocate cautiously optimistic we will hold the line on cuts both to research and program responses for the next fiscal year, which in our part of the world begins October 1st. So that's the good news. I also just want to say that the U.S. leadership on global HIV really spurred the way for additional U.S. investment in other global health programs, which has been incredibly important to some of the same people served by the HIV response, whether you're talking about malaria, tuberculosis, maternal and child health. And I do think that sort of recent acknowledgments with Ebola, with the Zika virus, that our world gets much, much smaller than we ever anticipated, especially when we're talking about infectious diseases, has made the American people, as well as the American Congress, if not the administration, much more committed to keeping that kind of global leadership. We know that the AIDS response has made countries more stable, more secure, and it is no surprise or coincidence that sub-Saharan Africa is the region of the world where they like Americans the most. And that has everything to do with the PEPFAR and Global Fund responses. But just to end on, I also just want to talk a bit about ideology, which I think we all worry about may rear its ugly head again in U.S. foreign policy for AIDS. Many of you know that the president signed an expansion of the Mexico City policy and the expanded global gag rule, which, as we're trying to take care of young women and prevent infections, has significant ramifications, not just for the global AIDS program, but for all U.S. global HIV programs. And while we are very heartened to see somebody of the caliber and commitment of Ambassador Deborah Birx remain at the helm of the program, it is true that the White House has also called for shrinking the focus of the U.S. global response to 12 or 13 countries, and explicitly says in their budget document that they will stabilize treatment roles in all other countries beyond that 12 or 13. And notable omissions from the target country list are the Republic of South Africa, with the largest epidemic in the world, Mozambique, one of the poorest countries of the world. So I think what remains to be seen is how much Ambassador Birx is going to be able to continue the kind of expansion of treatment services that are now going on in many more than 12 countries. And it's also important to note that PEPFAR funds a great deal of support for services for special key populations that may not be embraced at the country level in South Africa and elsewhere, that could be jeopardized by a narrowing focus of U.S. global AIDS policy. Thank you.
Thank you, Christine. And I'll maybe just put a human face to this for a moment as a recipient both of those PEPFAR funds and seeing how that they save lives on the ground, as well as a scientist who, certainly benefits from US and other developed country funding. This, I'm reassured that sanity will prevail, but obviously deeply concerned. And as president of the International AIDS Society, obviously hugely concerned that we can continue the momentum we need to make. As said, we either move forward or we move back. There's no static in our move towards the end of HIV. So that we really appreciate that. And then to say that whilst you've heard a lot about the US, I think this is right. They are the major funder. We're also hoping that the remarks that have been said here today will also impact the other top 4 and others who may be considering reducing their funding or not getting on the wagon. So we'll take questions from the floor now. Thank you everyone for their remarks. If you'd like to ask a question, please line up at the microphone as usual. When I call on you, just say where you're from and direct your question to a particular person. As always, please try and keep them brief and go ahead. Ryan.
Hi. Ben Ryan from Pause Magazine in the United States. I want to get one person from the U.S. and one person from an outside country to answer this. Just if you would be willing to, say Donald Trump were here in the room and he would listen to you, what would you say to him about his proposed budget cuts and how they may affect you and how you'd like him to change his attitude?
I'll pass on that one.
You will. Chip, do you want to pick that one up, or Greg? Why don't you each have a little stab at that? I think that's reasonable. Let's ask Chip and Greg, and then I'll ask Solange to
I'm
do
a
this.
half-full person. This administration has a tremendous opportunity over the next, is it 3 years or is it 7 years, to move dramatically towards the end of HIV and AIDS for kids, which I think is a necessary, as a required precondition for ending HIV and AIDS as a public health crisis by 2030. If we believe in big outcomes come from big investments, as we've seen from PEPFAR, we need to make that kind of investment, and there is that opportunity by this administration. The range of partners of other governments in the field that have been doing remarkable work, a comment on the research. The fact that we've seen the progress that we have in the last 5 or 7 years is precisely because of the research and the scientists that have brought more tools to bear, operations research that have showed us things like B+ and other steps that have been so important. So there's lots of things one could say, but where you only have one shot and one point to make, I would focus it on the positive. That's where we are. We're at a tipping point. We can tip back or we can tip forward. I would dwell on the tipping forward and the importance of additional investments so that we can continue the leadership to end HIV and AIDS.
Agree. Greg, do you want to just add to that?
Sure. I agree with Chip in the way that one of the ways that we could perhaps appeal to President Trump and others is by taking upon the mantle of what was already been built upon by a Republican administration and started by President Bush and getting us to this point where we are really seeing a reduction in new infections, a reduction in deaths globally, which is just incredible. It's definitely something none of us would have anticipated in 2001. The other point that I probably would make is that Ambassador Birx is doing a fantastic job as Global AIDS Coordinator. And exactly as Christine had said, I think as many of the efficiencies that we could potentially build into that program has already been done at this point. That everything that Ambassador Birx has done in focusing on the right interventions, focusing on specific populations, being as transparent as possible about the funding has been done. And that we do need additional investments. And why we need additional investments, and it's something that many of us have heard many times from Ambassador Birx and others, is because we're in the process now of dealing with the youth bulge, particularly in sub-Saharan Africa, that could potentially move all of our efforts farther back than we had ever anticipated. So for instance, in Mozambique, there were 1.4 million girls and women under the age of 25 in 1990. Today, there are 3 million. And those are women who are coming of age, who could potentially become infected with HIV. And we really need to make sure that we don't fall back with the cumulative efforts that we've had over the past decade or so, and step to the challenge and to continue doing the great work that we've done.
Thank you. Yeah, I am going to ask Solange now. Yes, please.
Wonderful. Thought you forgot. So, Mr. President Trump, I think I would focus on really ensuring that President Trump understands the power of the office of the President of the United States, and the United States continues to be a leader. And decisions made within the U.S. and from the U.S. affect the rest of the world. And if the United States truly believes that all men are created equal, then all men should have equal access to quality and affordable health treatment, HIV prevention, care, and treatment, and just the right to health, regardless of who they are, because it's a human right. So unless you're an alien, then you're a human being, and therefore all their policies, all US policies should line up with that. It seems as though we're sort of celebrating that flat line is the new increase, and we're happy about rejecting budget cuts, but that's in the context of a really bad geopolitical space. We're celebrating about something where we know that we actually need more money, and we're just really happy that you didn't cut it. So really to reflect on that and step up.
Thank you. Thanks, Solange. Thank you.
Hello, thank you for your intervention. My name is Ali Melgadari. I'm coming from Morocco. And I would like to know what is the region worries you the most, because last week I was with all of my colleagues in Beirut, and we are really, really worried about MENA region. And yesterday I hear nothing about MENA region, and it's increased, and it was the region with the less coverage of access to treatment. Thank you.
Thank you. Greg, Christine, do you want to pick that up at all?
Well, I would only say that I appreciate your concern, and I think certainly similar things could be said about parts of Eastern Europe, about West Africa, certainly, and I think this is one of the concerns we all have about any approach that limits the focus of the AIDS response to a handful of regions of the world and leaves others out, because that's not what 90/90 is all about, and that is not what it means to try to control HIV as a public health threat. That's a worldwide goal, not just a regional goal.
Correct. I think that is right.
Hi, I'm Heather Berner from Medscape in the U.S. And I feel like this is a weird question, but I feel like I have to ask it. I understand your appeal to try to save people's lives. However, am I the only one cynical enough to think that the U.S. government doesn't care about people's lives right now? There's a battle in the U.S. right now about taking away regular health care, which deeply impacts the care of people with HIV. And so I just feel like, I just wonder whether this is how you approach a government like this is really the question that I have.
Did you want to pose that at any one particular person?
Well, I'm most interested in hearing Greg Millett's thoughts, if you're willing.
Sure. I'm also speaking as a former federal official.
Yes, I know
in some
you
ways.
are.
So,
That's part of why I wanted to ask
I
you.
can bring both of those experiences to bear.
Yeah.
I have to tend to agree with Chip on this, that, the fact that even the healthcare bill that Congress was deliberating did not come to bear over the last few weeks is a very good sign. And it means that people do ultimately value human lives within their states. And the fact that we have flat funding for global HIV also means that the programs and what was started by President Bush is also something that's being valued by our friends in Congress, both Republicans as well as Democrats. So I can't say that I am necessarily depressed or feeling discouraged by the trajectory of everything. Many of us still did not know what to expect in the administration, and quite frankly, it's early. It's still very early within this administration. There's opportunities to grow. There's opportunities for us to do better. There's opportunities to start new programs that can, dovetail with the existing work that's been done. And quite frankly, I think that, Chip, Kathleen and others, all of us in this room, are really looking for those opportunities with the administration in the work that we do in Washington, D.C.
Out of necessity, I assume, in part, right? Like to try to find some
It's our
place.
job.
It's our job. But one other thing to say, too, is that you can't forget that there are many people within this administration who are also a part of the Bush administration, who were there from the very beginning of
think that's
PEPFAR,
right.
who really understand these programs and understand global health law. So we're not dealing with an administration where people are completely disconnected from the past. There is definitely quite a bit of individuals who have the history that we need, who we can speak to about this type of work. And I think that alone gives us quite a bit of hope.
Okay, thank you.
Sorry,
So-
can we just,
Ah.
can I say something?
Yes.
Because I really feel like I have a much less optimistic view, and I don't know if I should say something.
Okay.
Chip, did you want to speak on?
So
Put all the optimism first?
We're coming to the end of our time, so if you
Sorry,
can just... No,
yes.
Solange speaks, so I think if we can just go
I just
ahead.
think it's, when governments fail you, you need to resist and change them. I have thought about this a lot from ITPC's perspective, and the idea that you should reframe the issue as more of an investment, and so you invest in people because this is your labor force, and make an economic argument versus a human rights argument. But to me, the trend of the current government seems to be one where they don't really see that you invest in now to see the gains later. Just look at the decisions made on climate. So if that is an indication of where we're going, then we need to do something better. So maybe we band with my brothers who are much optimistic, but just that little
All
angle.
right, thank you. And I'm going to allow one more question just because we're out of time.
Right, sorry, my name's Ludovic Vickers. I work for the Agence France Presse news agency. Just a question regarding the recent breakthrough regarding the 9-year-old girl who hasn't received any treatment since being 6 months old. I just wanted to know, maybe Mr. Lyons, seeing as it's more your field, what does that mean for the future of AIDS research?
If it lasts, if she continues without signs of the virus, as Dr. Fauci said the other day, it's tremendously important because of the clues and the additional research and so on. I'm not familiar with the details of the case, so I don't think I can adequately respond much more. I bet Linda-Gail, not to put you on the spot, but I think you might know much more about it. But remember the so-called Mississippi baby. We've been around this track, tremendous hope that was going to indicate how and where and why we would be able, through immediate treatment. That was, the Mississippi baby was treated within, I think, 36 hours of birth. But then it came back. So Linda-Gail might know a little bit more about the science of it.
Sure, and I'm happy to speak to you afterwards. Tony Fauci just really encompassed that whole group of the Mississippi baby, the Visconti, the French teenager into one group of, we actually don't know what's going on there, but it gives us interesting clues, and definitely, is in the realm of understanding the HIV reservoir and remission. And we clearly need to keep researching those cases. So I would say, that kind of research needs to go forward, because clearly if we can reduce the amount of treatment people need, that treatment pool becomes more manageable. That means less required resources, which is better for the world in general. I want to add on just one note to say, to your point, I do think it is important also to acknowledge that huge amounts of money have gone into the AIDS response with great effect. And so it's a thank you in this regard. And so my response, for whatever it's worth, to President Trump would be, don't let this be your legacy, that you change that, you let that happen on your watch, because, we are in this incredible tipping point. I think there's this chance, much as President Bush kind of, he tipped something that was terrible in the early noughties. We were drowning in AIDS in the South. PEPFAR and Global Fund changed that, as well as, other donor funding. We're at that point again, and it's very important that we push through. So thanks everyone for your time. I'm sure the panelists will be here for other questions. I see that there might have been a question formulating there. Thank you for your patience, and enjoy the rest of the conference. And thank you for your interest in this question of funding, which is so critical.